Hi, I am Dr. Nitin Annarapu, consultant cardiologist at Isha Clinic, Hyderabad. Today we are going to discuss about coronary angioplasty, what is the procedure and then what we should know about it. Coronary angioplasty, also called as a stenting procedure, this is done to clear the blocks which were formed in your heart vessels. This procedure is advised for the patients who complains chest pain or breathing difficulty during exertion or at rest, and then angiogram was done where the blocks in the blood vessels are confirmed. This is a non-invasive test. That means there is no need to give an incision on the chest or anywhere. This can be done either through the hand, that is the wrist vessel, or that is through groin. It depends upon the severity. During this procedure, we can use radial artery, that is hand artery which goes to the heart, or it can be done through femoral artery, that is thigh artery which goes to the heart. First, we'll give a local anesthesia to make the area numb, and then we'll make a small puncture through a needle, and then we get an access to the local blood vessel. Then we'll place a plastic tube called sheath, and then we'll pass a guiding catheter, that is a long narrow tube which can be navigated through the hand vessel or the leg vessel, and then we can reach the coronary arteries, that is the blood vessels which supply to the heart. After giving a contrast agent, we can visualize the coronary arteries, and then as well as we can assess the blockages. Once we confirm the blockage, we'll pass a very small coronary guide wire, and then we'll cross the blockages with a small wire, and then over the wire all the balloons and stents can be passed. Then we'll pass a balloon, and then once it reaches the blockage, we'll inflate it. So we'll open the balloon so that whatever the block will be clear, and then the blood vessel will become little wider. Then usually we'll proceed for the angioplasty. Though angioplasty implies it's a balloon dilatation, it's routinely followed by stenting. So because without stenting, if just you do balloon dilatation only, so then usually it will again get narrowed. That is because of one thing is elastic recoil. Once you remove the balloon, again it may recoil, the blood vessel may recoil, and then it will become narrow. And second thing is, after balloon dilatation, sometimes we may produce minor trauma. So it usually will proceed with the stenting. The stent is nothing but a wire mesh tube, or it's a spring like device. Usually it is collapsed on the balloon, or it is crimped to the balloon, and then we'll pass the stent and position it in the area of blockage, and then we'll inflate the balloon. Then stent expands, and then it fixes to the coronary artery. It won't move, and then we'll remove the balloon. Then once we happy with the result, and then we'll remove all the equipment, that is catheter and then sheath and everything, and then we'll apply a pressure bandage. So this is a very safe procedure. And then before the procedure, usually we'll advise to be on empty stomach for 6 hours, and then they have to take blood thinners. So usually before the procedure, we will be loading them with blood thinner like aspirin and other antiplatelet drugs to avoid any stent thrombosis or blockage formation in the stent. And then after the procedure, the patient will be kept for minimum of 1 day in hospital, and then depending upon the indication, like whether it was a emergency angioplasty or non-emergency angioplasty, the patient will be discharged depending upon the situation. If it's a non-emergency and elective angioplasty, it's a planned angioplasty, patient will be discharged next day, and then he can resume activities within 1 week. And then if this emergency angioplasty because of heart attack, and then depending upon other disturbances like heart pumping, we may discharge after 2 to 3 days, and then patient when to resume activities, it will be it depends upon the patient's condition.